Hi guys, Alina Naraki here, and welcome to our implant series. Today we're going to be discussing the ways of how we can replace the teeth, missing teeth. Obviously, many roads lead to Rome, and the same thing here, many ways can be applied to replace missing teeth. And we will be discussing three different ways. One is an implant, one is a denture, one is a bridge. So, for example, let's talk about first option. Implant option has a definitive advantage of not damaging an adjacent tooth, as we are only replacing what it has been missing. Bridge option does require us to use adjacent teeth for support, therefore the tooth damage cannot be eliminated. With the denture option, there is no tooth to be spoken about, however, as it is supported by the soft tissues, which are soft tissues obviously not designed to carry the load. Eventually, the denture option contributes to even more severe bone loss. And we compare what chews better without a doubt. An implant would give you stronger force to chew as it represents the tooth, but slightly stronger. The denture will restore only 25% of your chewing capacity, what was there before. And the bridge will be somewhere in the middle. And just like anything in life, eventually, you will need to maintain your investment. The implant option is semi-permanent, which means it is either you or the implant gives out first. With bridge option, you will need to think about changing it around 5 to 10 years, and the denture will give you the shortest user time of about 3 to 4 years. Obviously, implant option comes out as a winner each and every time. However, it does carry initial investment costs. If you would like to understand the implant process better, please watch the video below. Any questions that you have or have ever had, please don't hesitate to ask, because we are going to be answering pointed questions from real patients like you. I hope this was helpful, and I hope to see you in the next one.